Welcome, everyone. My name is Dara Ray, and I am the president of Learn, a nonprofit organization here in Boise, formed to provide free quality education on aging and caregiving related issues to the community. And this is one of the sessions in our very first inaugural community education series. And we're pleased to bring you today the ABCs of Medicare and Medicaid, sponsored by Life Changes Elder Care. I mentioned we are an Idaho-based nonprofit. It stands for Lifelong Education and Aging Resource Network. And we have a mission to provide this quality community education on retirement and aging related topics in the areas of health, wealth, lifestyle, and caregiving. We are also a recognized leaders network of the Society of Certified Senior Advisors, one certifying body of many that certify and ensure that the professionals that you work with in the aging and caregiving industries are certified and vetted and qualified to provide you with the information and the services that you seek. And so we do encourage you to make sure that the professionals you're working with are educated, licensed, and or certified in their appropriate area. We do have a disclaimer that we share. We are committed to providing this information, but it is being provided for general informational purposes only and should not be considered legal, financial, or health advice. We do ask you to please consult your own legal, financial, healthcare, or service provider before taking specific personal action based on this information. Kristen Tracy has worked under the canopy of healthy aging for over 20 and is currently the Government Programs Engagement Manager at Blue Cross of Idaho. Kristen is a licensed social worker in the state of Idaho and has also earned her MS in gerontology. She has experience directing federally and locally funded grants, specifically in the areas of anti-poverty. Kristen's current role is Government Programs Engagement Manager at Blue Cross of Idaho, which allows her to work directly in the community with community members.
We are going to be talking about the concept of coordinated care under the canopy of managed care. And really the population that we're speaking about today are dual eligibles. So dual eligibles in the state of Idaho are individuals who are on enhanced Medicaid, and they're also on Medicare. And when you look at that population, typically those are individuals that have chronic health conditions. They may have a disability, or they have an incredibly limited income. And so this is really the population that we're going to be talking about today. In the state of Idaho, I think we have about 30,000 dual eligible individuals, and that count is growing every day. So we do have new people moving in, but some people also reach that level of whether it's with a chronic illness or a disability, or it could be age-related. Multiple factors and income factors play into that eligibility. So I'm going to forward my screen. This is just a quick disclaimer. We do not discriminate at Blue Cross of Idaho. And what we're going to be talking about, these plans are a zero premium plan. So that's really an important piece to remember. There are currently 2 plans in the state of Idaho that are authorized to, or that have contracts with the Department of Health and Welfare to deliver a Medicare-Medicaid coordinated plan. And those 2 plans are Molina Healthcare and Blue Cross of Idaho. So again, these plans are for individuals that are dual eligible. And we also partner directly with the Department of Health and Welfare. They have really strong oversight of both of our programs, Molina and Blue Cross of Idaho. In fact, my director is in contact with Department of Health and Welfare on a daily basis, as I'm sure the same with Molina. There's just a good partnership to ensure that we are delivering a strong product for duals and that they're having their healthcare needs met. And some folks kind of wonder, well, how did this all come about? And I probably should have said this a little bit earlier before, but back in 2003, the state legislature asked the Department of Health and Welfare to start to research some options for dual eligible individuals. They really wanted to see their health outcomes increase and those costs associated with that, with the treatment decrease. And, that's a high bar. So the Department of Health and Welfare did their research, and they looked around and they were seeing what was working in other states and what could be replicable in Idaho. And they came up with this concept of the Medicare-Medicaid coordinated plan. And really what that does is it takes Medicare and Medicaid, which were two systems that are great systems, but they originally were not designed to speak together and work really well together. It takes both of those systems and it puts them under one roof, either Blue Cross or Molina, and we administer those benefits. And so that's why this partnership slide is so important. We work with the Department of Health and Welfare really, truly as partners. And even though Blue Cross and Molina are working competitively to capture as many members as we can, we both firmly believe that this is the best route for Idaho's dual eligibles. And we just want to make sure that people are educated, that they know what the choices are, and we just want to see people in a Medicare-Medicaid coordinated plan. So are there any questions so far? Okay, I'll keep marching on, but if you do have questions, just let me know. So we're going to talk a little bit about where we got, or how we got here. And we'll talk about the Idaho Medicaid Plus and the Medicare and Medicaid coordinated plan. And sometimes on this screen right here, it talks about, it says HMO DSNP, but really that's the Medicare Medicaid coordinated plan. So that's what we just talked a little bit about, that it includes everything. It includes A, B, and D. So you've got Medicare A, which is your hospital. You've got B, which are your doctor's offices and services, outpatient services. And D, which is your drug, your prescription drug, and then Medicaid is also rolled into that. And this plan was first launched in Idaho in 2014. So we've been running, a Medicare-Medicaid coordinated plan for over 7 years and have learned a lot along the way. And then if you look over to the right side of the screen, there is the Medicaid Plus, Idaho Medicaid Plus. And those are for duals. That's a plan for duals that they don't really want to give up they don't want to move into a Medicare Advantage plan. They don't want to go into that Medicare-Medicaid coordinated plan. They just have their Medicaid coordinated through either Blue Cross or through Molina. They do receive a care coordinator, and it's great to have someone on the inside track looking at that. But really, I think the best plan and a really good way to illustrate this is to look at the MMCP plan, which is on the left-hand side of the screen, as the Cadillac. It is definitely the one with all the bangs and the whistles. It's a plan that's going to get our duals the best health care. It will identify gaps. They'll have someone to advocate for them. And then Blue Cross or Idaho Medicaid Plus is sort of the, I guess they call it the Kia of the car world. It's a good plan, and it'll get our members there, but it's not going to be probably as comfortable as the Cadillac. It won't have those heated seats and great suspension and all of that. The other analogy that I've heard is that the traditional Medicare and Medicaid services, the system like that, when the members are really trying to navigate both systems, that was called the Pinto. And it was just tough for members to navigate. So this is really what we're looking at in the state of Idaho, is this movement towards managed care for our dual eligibles.
So one question, Kristen, just to make sure I understand, the completely coordinated care is the special needs plan. On the Medicaid Plus plan, your client or the individual would still have their traditional Medicare and traditional Medicare drug or whatever they're doing, and then they'd have Medicaid, and they would. Yeah. Okay. Thank you.
Yes, and there's a couple of ways they can do that. Dara, I think that's a great question. A lot of times people will choose a different MA plan. So they may have a plan with, United for MA, and then they'll have their Blue Cross of Idaho or Molina Medicaid card. So
Okay, so they could
still,
even do a Medicare Advantage still for Medicare. They just aren't tying it together. So they can go either way
right.
on the right-hand side. Okay, great. Thank you for the
Yeah.
clarification.
Yeah,
Do you
very,
have,
yep. Oh,
do
yes,
you have to
Donald?
have both at the same time, Medicare and Medicaid?
Yes, you do. In order to qualify for this plan, yes. Yeah.
What
And
if you
we'll
don't,
get into,
but what if you
I'm
don't
sorry.
need Medicaid just yet?
Well then, yeah, you just would not qualify for this plan. Does that make
Okay.
sense?
Yes, sort of. I got here late, sorry.
Oh, okay. Well, we haven't even got to that part yet, Donald, so we'll get there. And
Oh,
yeah,
perfect.
keep asking questions because
All
I
right.
appreciate that. Yeah. Yeah, but really the big thing that we want duals to know is that there are a lot of choices. And that was one thing that was really important to the legislature because we just know Idahoans and Idahoans want choice. So there are a lot of choices, but we're here to really help educate too. That's our goal. So that's what we're trying to do.
Oh, absolutely, absolutely.
Yeah, and this is really where we are, Donald. You know, what is the eligibility criteria for members? So they have to be enrolled in Medicare and enhanced Medicaid. There are two levels of Medicaid. There's basic and then there's enhanced. So enhanced is just kind of what it says it is. It's a little bit of a step up because of some chronic health conditions, a disability, or you know, potentially very, very limited income. So it's a certain segment of that dual eligible population that has a lot of high needs and unfortunately high medical costs too. So that's who this plan serves. We also serve individuals who are age 21 and older, and they have to live within a designated service area. So I'm going to show you the counties that we're in right now. And the black counties, well, actually all of the counties right now that you're seeing, you'll see some in blue and some in black. Blue Cross is in all of these counties. I mean, we've been here a lot longer than Molina, so we've covered a little more counties. But the ones in the blue, so the ones in the black, those are the counties that Molina is serving also. So I wanted to be very clear. There are 30 counties representative. Molina serves in 21. Mary, is that right? Yep, she's nodding. Okay, great. I tried to make it easy, but I knew I would mess it up when I was saying it out loud. So Molina serves in these in the black 21 counties, and then Blue Cross serves in the rest of the counties, in all of the counties, the black and the blue. So there's good coverage out there, and you can see that we're growing slowly. You know, I think everyone's goal is to ensure that duals, wherever they live in the state of Idaho, could have the option for the Medicare Medicaid coordinated plan. But it takes time, and we're making sure that we're delivering really good services and that we can expand to continue to offer really good services. And hopefully.
And I'm correct in my understanding that Blue Cross and Molina are the two providers in the state of Idaho today for this dual plan, correct?
You are correct. For both the MMCP and Idaho Medicaid Plus. Yes.
Yep. Thank you.
Yeah. And here's just a little bit more of that overview of the program benefits. MMCP, you will see right here on the left-hand side. So again, we're talking about all of those medically necessary and preventative services covered under Medicare, with parts A, which is hospital, B, which are doctor and outpatient, and D, which is the drug. And then we've got those extra components in there because of Medicaid. So we have behavioral health, including the home and community-based services. Nursing home, we do have the A&D waiver services that are covered, which are really important. Personal care services, and then care coordination. And then over on the right-hand side, Idaho Medicaid Plus. This just basically tells you, you know, that we cover everything with that is under Medicaid. So we take care of some of those extra costs that Medicare doesn't take care of.
So that doesn't include like a Part G?
A Part G.
Well, Medicare Part G like covers deductibles and the things that aren't covered under A and B.
Oh, okay. Well, so
you're thinking, I hate to interrupt, but I think that you're thinking there's a difference between parts and plans. So part A, B, and D, and then there's a plan G. Okay, so the
Okay.
plan G is a Medigap plan, and most people who need Medicaid can't really or don't or really shouldn't afford something that has such a high premium. So you can have one, but it's not usual.
Okay.
And actually, I know, Donald, you joined us a little bit late. Teresa went over the traditional Medicare and the Medigap plans and Medicare Advantage versus the Medigap plans in the first half of the meeting, and we'll get that posted out on the website within the next 3 to 5 days. So you can go back and get that piece of it too.
Okay, great. Thank you.
Mhm.
Great, thank you. And both Molina and Blue Cross have those additional benefits that Teresa referred to earlier in MA plans. A lot of those preventative benefits. So you'll have things like, and this is just a snapshot, eyewear, hearing aids, gym memberships, telehealth, a nurse advice line, transportation, over-the-counter benefits. I know both plans have a catalog that members can receive, and they receive an allowance essentially that gives them a credit for every quarter, and they can use that catalog and purchase things like Band-Aids, Depends, incontinence supplies, allergy medicine, toothpaste, denture, all kinds of things, and it's drop shipped to their door. So, and I think even with Molina, they've got a debit card that they can actually go in and utilize that. So there's just a lot of great extra benefits for duals when they can check out these plans, and that's some things that can really help with some cost savings long term also. But obviously there's a lot of things in there that can help increase our health outcomes, and look at that from more of that preventative side. So I think Teresa really laid some great groundwork on that. And I would encourage you, if you know anyone, to either get in touch with Mary with Molina or myself with Blue Cross, and we can tell you more in depth about our plans and what they offer. But there are a few carve-outs that the Department of Health and Welfare decided to keep. And these are services that they had when they had traditional Medicaid. So what our members will do is they'll still use their Idaho Smiles dental benefits. Many Medicaid members have an Idaho Smiles card, so they'll continue to utilize that. Their developmental disability waiver benefits, things like targeted case management, all of those still stay intact. And that's a real a benefit and a win for those individuals who are in the disability community, because they don't have to start all over with those services. Non-emergency medical transportation benefits still stays intact, and the Department of Health and Welfare still oversees that contract. And then intermediate care facility services, they're still under the canopy of Health and Welfare. And then we're going to talk really briefly about why you would really want to join the fully integrated plan. And that's care coordination. That's truly the crown jewel of all of this. And that really comes down to a care coordinator. Care coordinators are individuals who members are assigned to, and they actually serve as the point person for the member. And the three things that I really like to think about with care coordination is that they help the member navigate the system, they advocate for the member, and they ensure that there are no gaps for that member. And that's the most important thing I'd like for you to take away today. It's just to know that if you've got someone who is a dual eligible member and they sign up for an MMCP plan, they will have an advocate, whether it's with Molina or Blue Cross. They're going to have somebody right there in the system that understands Medicare, Medicaid, and the system that they're working within, and that will help coordinate all of those pieces. And that's a huge administrative burden taken off the member or their caretakers. So, care coordination is a collaborative effort of nurses, social workers, counselors, and qualified health professionals, and clinician support staff to help support our members. It's a patient-centered approach, and we work with members by meeting their specific needs and conditions. So one thing that's really important with care coordination, care coordinators sit down with the members. They haven't been able to do so because of COVID this last year, but pre-COVID, and we're hoping to get back to that model very soon, where they can sit down one-on-one with a member and their family members if they choose, or those caretakers, and work on a plan with them, identify their health care goals, and help them meet those goals. So it's a really nice thing. And if members don't want that extra contact, they don't have to have it, but we highly encourage members to do so. And we have seen that the healthcare outcomes just improve over time. So I can't say enough about care coordination. I'm going to switch to our next. So really, what does the care coordinator, this is one of my favorite slides. This is a little diagram that just sort of shows the member, the you is supposed to be the member, and their family, or maybe their caretakers in the middle of that circle. And the care coordinator's right up there at the top, and they just help them navigate their primary care provider. They can help with those appointments or talking to specialists and making sure everything is all in alignment. They can work with home care providers, family members. Maybe there's some sticky family situations, and they can just help with that. Mental health, behavioral health is definitely covered under these plans, and so that's a service that we also coordinate. And then those transitions of care. You know, oftentimes people will transition from to a higher skilled environment when they require that level of health care. So we can also help with that. Any questions so far on care coordination and what they do? These plans are also very interested in continuity of care. So when we have members that come to our plans and sign up, we are an HMO. And as Teresa had talked about that bullseye, we've got that bullseye. So we have a network of doctors. And we want to ensure that that member has continuity of care. So if they have a doctor, they sign up for our plan, and they've got a doctor that's not in that bullseye, we will continue to pay that doctor for 90 days for whatever they were seeing that doctor for before they signed up. And we'll work with that doctor to see if we can contract with them to get them in network. And if for some reason that healthcare provider decides not to join, then the care coordinators will help that member find a provider that's comparable and within the network, within that bullseye, so they don't have any out-of-pocket costs. And I think that that's a really important service that we offer. That's part of that navigation piece. And as Teresa was talking about, some of those networks and formularies, it's just those are the really important things that you want to look at when you sign up for these plans. And it's true with MMCP too. You just want to make sure that your doctors are a network and that your drugs where they are on the formulary too. So those are important things to look at. Any questions? Okay, it's also very easy to identify. I know we're throwing tons of acronyms and new terms at you. MMCP, TBSMP, IMP, there's lots of stuff going on. So we just thought I'd show you really brief cards. Now this is just for Blue Cross, and Molina has made theirs very clear too. I don't have access to their stuff, but I thought I'd show you Blue Cross's really fast. Right over here on the left-hand side, it clearly says the True Blue Special Needs Plan, which is sort of the, that's our trade name that we use in the public, but it does says HMOD SNP, which is the Special Needs Plan. So you can see that, and it does have the Medicare logo down there at the bottom. And then over to the right-hand side, that is our Medicaid card, or our Idaho True Blue, or our Idaho Medicaid Plus. Yeah, Idaho Medicaid Plus card. Sorry, gee, talking too fast. And we've got that clearly labeled there too. So it's just important, I think, for members to be able to recognize, and for the general public to know too, that hopefully you can see what an individual has.
And question, Kristen, on the Medicaid Plus. So I know that are Molina and Blue Cross the only two that do Medicaid at all, or is it just the dual eligible piece? Is it Medicaid at all? Is Molina and Blue Cross?
Well, and that is such a great question, Dara, and I should have said this a lot more clearly at the beginning. So dual eligibles is, if you think of it as a canopy, so those individuals that are dual eligible, and let me go back to my slide. So if they are enrolled in Medicare and enhanced Medicaid, they're 21 years old and they live in the designated service areas, that defines who a dual eligible is in Idaho. And then they have two choices. They can either choose, if they're interested in coordinated care, they can either choose the MMCP or Idaho Medicaid Plus.
Okay. But there's not like
that
a state, I think so, but there's not like a state-run Medicaid offering. The Medicaid offerings are through, or is there another option out there too?
For the enhanced
there is.
Medicaid.
Okay.
Oh, yeah, Mary, I'm not sure I heard. And
For the enhanced Medicaid, it's
Oh,
Blue
right.
Cross or Blue Cross of Idaho or Molina for the enhanced Medicaid, and then you have basic Medicaid. You have the CHIP, program.
And that's all
Those are-
still separate.
Yeah,
Okay.
but
Yeah.
for between our plans, between Blue Cross of Idaho, what Kristen is speaking to, and Molina Healthcare of Idaho, that's for the enhanced Medicaid.
Okay. And the eligibility that you were talking about was the enhanced, is that the eligibility for enhanced? Am I thinking about that the right way?
Well, so we don't determine between basic and enhanced. That's done within the walls of IDHW, of Department of
Okay.
Health and Welfare.
Okay.
So the members should know. If they don't, we can give them a number to call. So yeah, once that determination is made by Health and Welfare, then we'll know, if they're enhanced or basic. If they're basic, then they just don't qualify.
Okay.
And Dara, I'm not sure if you were getting to this, but if you can see on this screen, so all of those counties that are grayed out, those individuals, if they're dual eligible and they live within the grayed out areas of Idaho, we don't have service there. So they're still on traditional Medicare and Medicaid. So
Okay.
that system is still operating out there. But currently, Blue Cross and Molina are the only two that offer the coordinated care plans in partnership with the Department of Health and Welfare, and we have that level of oversight in that contract.
Okay. Now I'm clear. Thank you. Sorry,
Yeah.
it took me a while to.
It does. It's a lot to take in, and every time I speak to it, I keep thinking, oh boy, I have new illustrations of how we can do this and how to really explain it, because it can be a little bit complicated. And I think once we have better coverage throughout the state, it'll be a little bit more clear. But we're still just growing, and so it's a little patchy. So there's a lot of pieces that are floating around. So yeah, feel free to ask questions or reach out to Mary and I with any questions that you may have, and I'll just get to the back here and yeah, open for questions, thoughts, concerns.
Well, one comment I do want to make, Kristen, to kind of dovetail off of what you just said, in the fact that it is complex and it is complicated. Now think about if you're in a situation where you're that member, you're that person, needing this, and you look at, how confusing it might be for us, on this call today, but then you have medical issues, maybe you have behavioral health issues, you're thinking about finances, where's my next meal going to come from, all of those kind of things. And, that I think is a perfect illustration of why, this coordination, piece is so very important.
That is so true. And yeah, what Mary said, it streamlines it all for the member, makes it easier. It's a difficult thing to illustrate and to talk about, but really in the end, what matters most is it's just easier for the member and for their families or caretakers to manage that piece, because you've got some professionals right there behind them that are in the system and that can just help.